Hello. Here's a brief demonstration of how I do a spinal exam on my patients. This is Rango. He is Haley, our therapist and trainings dog, who does a lot of agility. So I start up at the atlas and palpate the wings of the atlas and gently push them from side to side to ensure that there's no discomfort or hopefully instability there. I then palpate the sides of the neck where the transverse processes are going down each vertebrae from C2 to C7. C7 is going to be medial to the shoulder joint, and so I will put my index finger medial to the greater tubercle, and you can actually see him react just a little bit there as I palpate C7. And again, just assessing for any kind of pain or significant stiffness. And again, you get just a little bit of a reaction there at C7 on that right side. I will then come down and palpate the first rib by kind of hooking my thumb over the top of it and gently pushing down a little bit to assess for pain there. And I'm coming back to that C7 again just to make sure that, and again, it doesn't really have a whole lot going on there. Next, I am going to compress the ribs as I go down the thoracic spine because the rib heads articulate on the transverse processes of those vertebrae. For the cranial thoracic spine, I'm going to angle my hands slightly forward as I press down on the dorsal spinous processes, and then straight up and down as I go down the caudal thoracic spine through the lumbar spine. I'll use my thumb to assess the lumbosacral space as well as the sacroiliac joints on both sides, and then also gently check for motion over the sacroiliac joints with the butt of my hand over the wings of the ilium, and also palpate the sacrotuberous ligaments. And then lastly, I'm just going to come down the lumbar spine again, individually assessing each vertebrae, making sure that I do get a little bit of range of motion without any significant discomfort.